Hey, my name is Anisha and I'm obsessed with all things career development. I am a pharmacist turned entrepreneur who's transformed my passions into purpose. I've grown a podcast that has reached thousands of people across the globe. I'm building an online business and I've left my 9-to-5 to chase my dreams. I've walked this path of transformation myself, and now I'm here to share insights, strategies, and stories to help you carve out a career that you love. Career opportunities, personal development, challenges, growth, and building life skills are all things we discuss on this podcast. Be prepared to be inspired and motivated to step outside of your comfort zone. This is the Pharmacist Diaries podcast.
Welcome back to Pharmacist Diaries. I have the pleasure of speaking to Hiba Zitouni today, who is living in the United Arab Emirates. I'm really excited to have you on the podcast this morning. You are a recent pharmacy graduate, which is really exciting, and you've recently completed your internship, which is a training element of becoming a pharmacist in the UAE. And you'll be soon taking your exam to become a qualified pharmacist. So welcome to the podcast.
Thank you. Thank you, Anisha, for having me. I'm so happy to be here. It's such a pleasure. It's a first experience, but definitely an exciting one. So thank you.
Well, you're my first guest from the UAE, which makes me super happy because I've been looking for someone to talk to on this podcast from there, and especially with my previous connections of working in Abu Dhabi, it's really exciting for me to share a conversation with someone who is currently living there and experiencing what pharmacy has to offer. So I guess to kickstart my episodes, I always ask my guest, why did you choose pharmacy in the first place?
Oh, the famous question. So, contrary to what everyone thinks when I tell them that I'm a pharmacist, choosing pharmacy was not something that I thought long and hard about. Now that I'm actually thinking about it, I believe that everything happened just so fast, and it was more a pharmacy choosing me than me choosing pharmacy. So, I'll take you 4 years back from now. So, I remember after finishing high school, my family had moved abroad to KSA, and by the time I had all my transcripts, my high school degree, and everything ready, admissions were already closed in KSA, and I did not want to waste another year of my life waiting for admissions to open again. And I remember this one afternoon, my mom was talking to a friend of her who was living here in the UAE, and it was actually her who suggested me coming to the UAE because her children was going to uni here as well. And the UAE is not that far from KSA, so I can see my family often. It was not a very weird choice, and the education here is well known for being good and for being rewarding. So I went through the university's website, and I always wanted to do STEM. I went through the university's website, and to be honest, the only program that still had its admissions open and piqued my interest was pharmacy. So I didn't really think that much about it. I just said to myself, okay, I have the grades for it. The admissions are open. I think I have a chance. It's interesting. And also, I had some family members in pharmacy as well. So I kind of knew what I was getting myself into. So I just applied and thankfully got in. And now here I am today.
That's amazing. Can you tell me a little bit more about what STEM is? Because there are people who are listening who might not know what that is.
I think it's scientific fields like anything that involves biology, chemistry, physics. I was not a big physics fan, so that was a big no-no for me. So yeah.
Okay, great. And how did it feel for you when you made the decision to move countries? Because you embarked on this journey straight after high school when you're 18, 19 years old, and you were leaving your family behind, your home country, all your friends, and going to a new country. How did that feel for you? Because you've come alone.
Yeah, it actually only hit me once I got here and I was left alone for a good 2 or 3 weeks. It was only then that it hit me, and it kind of hit me like a rock. I did not process it the best way possible. I remember my mom coming here with me for my first week, and I remember her staying with me in my dorm's room. And the day she left, it was kind of a reality check to me. I was just thinking to myself, wow, now I'm here alone. And I have to stay here because I'm already here. There's no going back.
As a pharmacist, I know firsthand how challenging it can be to maintain our health and well-being whilst caring for others. I am a true believer of making the time to look after my physical, mental and emotional health, and I love the idea of using natural supplements to support me on this journey. That's why I was so excited to find The Naked Pharmacy. Their products are 100% plant-based and naturally sourced, 100% biodegradable, and it feels really safe to know that they are formulated, tested and manufactured to the same standard as a pharmaceutical product. However, the most important fact to share is that their CEO and founder, Kevin Levers, is a pharmacist with over 35 years of experience in the pharmaceutical industry. I love that as a community, we can support our pharmacy colleague every time that we purchase a product. As a Pharmacist Diaries listener, you get an exclusive 20% discount off all Naked Pharmacy products using the code PD20. Just visit www.thenakedpharmacy.com and treat yourself to something new.
But yeah, and especially only after a semester COVID hit. I only did like one semester of schooling, and then COVID hit. And that one break turned into a month break, and the month break turned into a 3 month break, and now we're just staying at home. And despite the universities and the professors' efforts to keep everyone involved, to keep the system running, basically, it was very challenging to stay focused, to keep up the high spirits. And now, and then at our senior year, when we went back to uni, it didn't feel like we're picking up from where we left from. It just rather felt like we were back at square one. You're at your senior year, and it's now that you're getting to know your colleagues. You're trying to get involved in as much extracurriculars as you can. So it was a unique experience.
It is quite challenging. I mean, I moved countries at the age of 15, but I did have my family with me. So for sure, the experience was very unique and challenging, leaving my home country and then having to go to high school in a new country, new city, not having any friends or anyone to kind of resonate with. But to go alone is very courageous, and I commend you for that, because it just is really quite a bold move that a lot of people maybe don't realize how valuable it is. And we have a lot of pharmacy students who are international here where I teach as a lecturer at King's College London. And a lot of those students do the same. They come here, leave their family behind. And some students have traveled, the flight could be 10, 11 hours to go home, and they only go home maybe once a year or once every couple of years. And it's incredible how they immerse themselves into student life and making friends and things like that. So a really cool opportunity, and I'm sure it's going to make you stronger, because it isn't easy to make friends and build relationships and feel like you're at home. It can be quite challenging, it can be quite isolating, and especially dealing with COVID and the pandemic and being at home so much alone, that must have been really tough for you. What I'd like to know is a little bit about what the pharmacy curriculum is like as a international student in the UAE. Tell me about that.
All right, so I did a 4 years bachelor. During your first year, we were mostly taking, let's say, more of general subjects: biology, chemistry, biochemistry, organic chemistry, and things like that. We were taking a bit of anatomy and physiology here and there, physical pharmacy here and there. We only had a introduction to pharmacy practice. The course was called Introduction to Pharmacy Practice, and it was only by the second year that we got actually into more pharmacy related courses like pharmacology and therapeutics and similar subjects. And by by the end of the second year, we had our first training or placement It was at a community pharmacy. And then at our third year, we had a industry training. We went to, I don't know if you're familiar with Jalfar.
Yeah, I know them.
Yes, we had a 2 weeks training there. And then fourth year was also mostly rotations in hospitals and community pharmacies, but it was mostly focused on hospitals, I'd say, because we have already done a community pharmacy placement before that. So yeah.
That's interesting. And what was your perception of what pharmacy was going to look like for you as a graduate? Like once you actually qualified, when you first started as a pharmacy student, what were your feelings about being a pharmacist and what did you know about what a pharmacist could do?
Oh, that's a very that's a question I keep asking myself. But I would say I noticed that there was a gap between theory and practice. What we witnessed during our training or placements wasn't necessarily what we were exposed to during our theory lectures or whatever we were told about the industry or the working as a pharmacist overall. But I would say it was also very dependent on the institution I was doing my placement at. It felt like every institution was running its pharmacy, let's say pharmacy system, uh, according to their own standards, according to their own guidelines. It wasn't a unified system that I have witnessed in all institutions. It was more like every institution doing their own thing. And for instance, not all institutions had clinical pharmacists. Some of them were just like running on OPD, on inpatient and outpatient pharmacists. Some didn't even have inpatient pharmacists. On the other hand, there were ones where they had their pharmacy system was top notch. Everything was like by the book, let's say. So yeah, it was kind of interesting to see both sides of things.
How did that make you feel in terms of your perception of what it was going to be like working in the field as a qualified pharmacist when you know you're going to have that opportunity soon, but going through that experience and seeing some facilities who are, like you said, by the book, do everything correctly and what you expected, whilst other organizations not necessarily following what you thought you'd see and not having all the services that you know and kind of gained awareness of.
Honestly, it left me feeling a bit lost and a bit confused as well, in context of I don't know what can I do or how can I get where I would be practicing pharmacy at the top of my license. So um, I kept asking pharmacists that I have trained with, or those who were my supervisors. I was bombarding them with questions. Actually, I was harassing them with questions. I would ask them about each and every single thing. I wanted to grasp as much information as I could get because honestly, where's the next time I'm going to be able to meet all of these people at one place? I try to learn from their experiences. I try to take their advice. And most importantly, steer away from negativity because it is very easy to fall into that trap. It's like a domino effect, you know? Like there is one negative person pushing the other down, and so on. So I was trying my best to not fall into that. It was very challenging to not to do so because some environments were getting toxic to some extent. So I try to not let that affect me. I'm still trying till this day because I think it's just a healthcare thing. I hear a lot of my, let's say, dentistry friends, nursing friends experiencing the same thing. And I'm just starting to think, oh, so it's not only a pharmacy thing, I think it's a healthcare thing overall.
It's interesting because obviously I've experienced working there for a few years. And one thing that's different to the UK is healthcare is privatized for most people. So you have your private medical insurance card that you would, as an expat, you would be provided with this from your employer under your visa. So I was really fortunate at both jobs that I had where I had really good medical insurance and good medical cover. And this system and way of working is very different to what we experience at home with the NHS. And when it comes to standardization of sort of services, what pharmacists are able to do, the guidelines that we use. And I think because the UAE is still a relatively new country, they haven't quite got to the point where they've been able to create their own guidelines and their own standards. So when I was working as a pharmacist and we had a formulary, a list of drugs that we were able to dispense and doctors were able to prescribe, but the choice in terms of guidelines and evidence-based practice would come from other countries. And each individual doctor would use different guidelines depending on where they were from. I worked with doctors from all over the globe. So some people might come from Saudi Arabia or Kuwait or America, England, and they're used to using specific guidelines from their home country. And they come to the UAE, but they stick to those old guidelines. So it's hard to get that standardization because the private healthcare insurance allows you to prescribe in this format as long as it's covered or that drug and that indication is covered for the patient, they can access that medication. But when it comes to the actual formulary, there isn't always a standardization with regards to the type of patient that can use that medication, the kind of cost that comes around using that medication and the evidence base behind it. Now, things may have changed because obviously I've left 6 years ago, but when I was working there, a good example is that there was a pain clinic at Cleveland Clinic where I was working, and one doctor may see a patient with back pain and prescribe simple paracetamol, maybe some ibuprofen, and they'll allow the patient to give that a try, see what happens, and then they come back to clinic for review. But another doctor might straight up give paracetamol, ibuprofen, oral morphine, and fentanyl patches. And there's a big difference in what doctors feel comfortable prescribing and what they feel is necessary. And when you get the patient at the counter and you're counseling them, what surprised me was that it's the type of patient who's experiencing back pain for the first time. It's relatively mild, but they're going home with 4 or 5 treatment options. And when you're trying to counsel them on what medication to try, first of all, there is a difference between their perception of pharmacists as healthcare professionals. So a lot of the time I'd get the feedback that, hey, thanks for your advice, but I'm going to follow what the doctor told me to do, regardless of what you have to say, which is really different to what I experience here in the UK. But another thing is that the doctors haven't necessarily explained like the step up in treatment, that, hey, you can start with paracetamol as an example for very mild pain relief. And if that doesn't work, this is what you do next. This is what you do next. And how many weeks in between that you might step up the treatment as well in terms of the pain relief. So patients go home thinking that they're meant to use all of those medications at the same time. And I found this way of working, this kind of culture difference, really challenging as a healthcare professional. I was so used to having quite standardized guidelines. Like we use the World Health Organization's pain ladder when it comes to prescribing pain relief. This is what we teach our undergraduate pharmacy students, and it's what we use in the hospital. It's definitely what we might use like in a GP practice or in a community pharmacy as well. So we're very used to using quite standard national guidelines or international guidelines, but working with doctors from all over the globe, when you live in a country full of expats, it's a very different experience and is one that you kind of have to get used to as a new pharmacist as you graduate, that the country is still developing guidelines. Even the hospitals will be developing their own guidelines. So you might find you work in a hospital that have started creating their own guidelines, or they tend to prefer American guidelines, because I worked in American hospital, so it was normal to use everything from the US. But then I might go to another hospital and see that they love using the BNF, which is one of the, my favorite resources as a British pharmacist. And that variety makes it quite challenging for you as a new professional, because it can be quite confusing, don't you think?
Yeah, and I completely agree with you on the part of where you mentioned people's perception here. Believe it or not, I have met not one, not two, not three patients who did not even know it's a pharmacist. It just took me by surprise. It only happened to me recently. I was on my break, and there was this old lady with her bags of medications, and she was fetching through it. She looked a bit confused. Then she looked at me. I had my white lab coat on, and she just asked me, "Are you a doctor?" I said, "No, but I'm a pharmacist, so I can help you with your drugs." She was a bit hesitant, and then she approached me, and she started. Most of her medications were OTC. She started showing me her medications and asking me what is each one of these used for. And I asked her, like, I'm pretty sure you picked these medications from our hospital, and I'm pretty sure that you got some counseling on these. And she just didn't think that a pharmacist can help her with that. It wasn't even a thing to her, someone that can help me with my medications. So I just literally spent my whole break with her, trying to explain to her what each and every medication is used for, and how she could use them the best way, and when she can stop them, and what she can avoid if she experiences any side effects. And she was super grateful. And the last thing she said, "I'm gonna make sure to ask my pharmacist the next time." And I'm like, yeah, you should. You definitely should.
Well, that's amazing. You were making an impact to a patient's life, on one of your placements or during your internship. So that's incredible. I was going to ask you, how do you feel about living in the UAE and building your network as a pharmacist? Because this is something that I get asked a lot about. As a British pharmacist, obviously, I moved to the UAE and found it quite challenging to find a job. I'm very used to finding everything on the internet here in the UK. Jobs are very clearly advertised, whether it's on a recruitment website, on the NHS jobs website, which a lot of the hospital jobs are advertised there. A lot of people use LinkedIn, places like Indeed, but it's very common to just find information about recruitment and what jobs are available through the internet, through Google. Whilst moving to the UAE, I felt like I could not find anything through recruitment agencies. There were things that were available through LinkedIn, but I probably applied for over 100 jobs in the first 6 months and never heard back from any of those organizations with regards to recruitment. So as a pharmacy student and obviously as a recent intern, what have you been doing to enhance your network? Because this is really valuable as a pharmacist in the UAE, because what I discovered was that you need your network to kind of find a job in the first place. And for me, I moved to a country where I didn't know anyone. I had no idea what pharmacy was like. I didn't have any friends who were pharmacists. So building that network from nothing took so much time, energy, effort. I obviously used LinkedIn as my kind of baseline, but I started attending lots and lots of conferences to try and meet people who were already working as pharmacists, understand what they were doing in their roles as hospital pharmacists, where is the best place to find out about jobs. Maybe conferences was a good place. That's what I thought. So tell me a little bit about your journey as an international student and what you've been doing to kind of enhance your network.
So I think the best connections I have made were with people that I have already worked with or had placements with, or were my supervisors during my placements. it was so much easier to connect with those people, given that we kind of met each other every day. We were doing shifts together. I was learning from them. I was teaching. They were teaching me. So it was much easier to connect with people that way, rather than just attending conferences. And I would like to mention that attending conferences as a student, especially that during COVID, we weren't able to attend a lot of conferences. So it was a bit intimidating to approach people. It was not the easiest thing just to go to present yourself. And given that we mostly attended conferences in Dubai, so you would only meet pharmacists in Dubai, in that region. Of course, some of them would come from other Emirates like Abu Dhabi, Ras Al Khaimah, Sharjah, and things like that. But it would be mostly pharmacists in Dubai. And as you already know, Dubai is a very saturated city. The work there, like the industry is super saturated over there. So even if you connect with pharmacists there, a lot of them are not really able to help you, because first of all, there's a lot of internal hiring. That's why you don't see a lot of job ads. That's why you don't hear back from your applications. And I just recently witnessed that at our hospital. One of the pharmacists left and they just did some internal hiring, and that's it. Yeah, so I think connecting with people in conferences can be a bit challenging, especially if you're a foreigner or a student or someone who haven't been here for so long.
What I found hard was that I didn't speak Arabic, and everyone speaks English, amazing, and it's easy to communicate with people, absolutely. But when you meet people and they're standing in a group of 5, 6, 7, 8 pharmacists and they're enjoying conversation at a conference, and you kind of windle your way into the conversation, say hello, introduce yourself in English, everyone continues conversation in Arabic. And that was so hard for me because it would obviously be really difficult to then kind of share my opinion. And this happened at work all the time. And I was really lucky at CCAD when I worked at Cleveland Clinic. Obviously, those people were my friends. So I would just say, like, hello, guys, I'm still here. Can we switch the language? I really want to hear what you're talking about. And then, they'd remember to kind of change the language. But at a conference when you don't know anyone and you're trying really hard to make connections with people, it was quite a struggle for me. But I did persevere with it because, of course, I was already living there. I was very determined to try and find a job. I tried not to take it personally. They're not trying to leave you out, from the conversation. It's just when you start speaking Arabic and you're just in the flow of it and you're just enjoying conversation with people, it's easy to forget that there's one person in the room who doesn't understand what you're saying. So it's not intentional, but from my point of view, it did become, like you said, it felt a little bit intimidating to go to conferences and feel a little bit left out at times.
Trust me, I feel you on that level, because I might be Arab, but I speak a completely different dialect than what everyone is used to here. So a lot of times, as soon as I start speaking in my own dialect, everyone is just looking at me like, is this girl even speaking Arabic? I swear. So it's either I have to change to another dialect that is more commonly used here, or even like resort back to English, which might not be always an effective way of communicating with people. Some just prefer to communicate in Arabic. It's easier for them, it's their native language. So yeah, I feel you on the language level. I had to switch dialects. I ended up with a bland white accent, so I'm still working my way through that.
It's really important to share that, though, because when you work as a pharmacist in different countries, you're going to be exposed to different cultures, different, the diversity changes, the language barrier is difficult. I had to learn a lot of Arabic when I was working at Cleveland Clinic because there were a lot of local patients who, especially the older generation, who don't necessarily speak English. So there were times where I would be faced with a customer who doesn't speak any English at all. What I did love about the culture was that if you're trying to speak the language, they do get very excited. They do help you to learn. So, in fact, I learned a lot of medical language from my patients. People who were sitting with me at my counter, waiting for their medications, I would be learning different bits of information from them. And they were also willing to allow me the time to try and use my language as well, to the best of my ability. But it is definitely frustrating when you're a pharmacist who wants to get a point across when you're trying to educate a patient, especially on more complex medications, even something like a dalteparin injection, or methotrexate tablets or warfarin, and having your INR taken. There was no way I would allow myself to feel safe and comfortable counseling a patient in Arabic for those types of medications. So for me, what was frustrating is that I'd have to wait for help. And my colleagues were amazing and they always used to help me. But it's quite frustrating for the patient, isn't it? They have to sit there and wait for somebody else to come and counsel them. And there were times where people would look at me and automatically know that I don't speak English, and they would immediately just request that someone else come and support them before I even said hello. So sometimes that was quite challenging for me as a healthcare professional. But these things are really valuable to share on this podcast, especially because there are a lot of people who follow me who love the idea of working in the UAE and living in another country. And there are so many incredible benefits of living there, especially when it comes to the lifestyle, the weather, and just enjoying what the UAE has to offer. But as a pharmacist and a healthcare professional, there are definitely changes, adjustments, and adapting to a new environment that you have to kind of shift that mindset quite quickly in order to be happy. And I said this to you last time that we had a discussion, that if you can accept a lot of the differences in the culture and the ways of working and the work ethic, and do your absolute best in your job and be the best version of you as a pharmacist when you qualify, you will be happy living and working there. But it is very different in terms of the culture to what I'm used to here in the UK.
Yeah, just to reassure you, Anisha, regarding the counseling in Arabic, and actually, I feel like it's something that a lot of us are going through because we do our schooling in English. So even when I graduated and I first started meeting patients, I wasn't very familiar with counseling terms in Arabic. I had to sit there and write down after, like, what pharmacists with me were saying, and I just had to write notes here and there. I remember this one colleague of mine, he just sat me there and he started teaching me words, like how to say this in Arabic to patients, how to say this and how to say that. So even us Arabs, fresh graduates who did most of our schooling in English, it can be a bit challenging because we're not familiar with those terms in Arabic, except if you've been in the industry for so long and like you're exposed to such terms, it gets easier. But if you're just a fresh graduate, you've done all your schooling in English, it can be very challenging, and you'd start counseling in English and then the patient is looking at you. What are you trying to say, Mr. Pharmacist?
Yeah, it is different. We were quite fortunate at Cleveland Clinic that all the labels had the instructions in Arabic. In the early days, it wasn't perfect in terms of the translation, but by now I'm sure that they've mastered that, and the quality of the information on the translation element has improved significantly. So that's definitely useful for a lot of patients. It will be in English and Arabic, which is good. How did it feel for you as an intern pharmacist? What did you get exposed to? Did you work in community and hospital and industry, or how does it work as an intern once you finished your undergraduate degree?
Yeah. So as an intern, you get to choose whether you want to do your internship at a community pharmacy or at a hospital pharmacy. I preferred doing it at a hospital pharmacy. I felt like I could get more exposure that way. I did my internship at SKMC. I think you're familiar with it, right? Yeah. I did a 6 months internship there, and it was basically rotating throughout the inpatient pharmacy, outpatient pharmacy, and there was also a diabetes center pharmacy. So I kind of did 2 months, 2 months, 2 months at each. In the inpatient pharmacy, it was intense, I have to admit. We were more of doing like, it wasn't me basically, it was the pharmacists that were training me. They were doing the jobs of clinical pharmacists. They were sitting there reviewing charts, making recommendations, checking updates from they were doing all the work, and we as interns, we would just help them however we could, whatever they assign us to do, we would help them. And of course, that's how we learned, by actually getting some hands-on experience. And if there are any spare time or like during breaks, that some of them would sit with us, discuss cases with us. For the outpatient pharmacy, it felt like a community pharmacy a lot of the times. So you were just doing dispensing and counseling on medications. And similarly at the diabetes center pharmacy. But I have to say that I know that I have learned much more compared to what I would have learned if I were to do my training at a community pharmacy. Because at a community pharmacy, it's very slow paced. Um, and it also depends where your pharmacy is located. If it's not a populated area, it can be very slow paced. It can get boring, and it wouldn't be as good as doing your internship at a hospital.
Yeah, because a lot of the things that you learn as a pharmacy student are very clinical in nature, aren't they? You're learning about different disease states, different drugs, and anything from the indication, dosages, side effects, interactions, and then applying all of that knowledge into practice feels a lot easier in a hospital setting because the systems and processes allow you to feel more of a clinical pharmacist, whilst community pharmacy in the UAE is not as advanced as what probably other countries have to offer at this point. You do quite a lot of basic work as a pharmacist, but you're supporting people with over-the-counter kind of minor ailments and supporting with buying things, products. But I think the role of the pharmacist hasn't expanded as far as we'd like to see and what is available in places like the UK, Australia, America. But I'm sure that will come with time. But I think they probably need to work on the perception of what pharmacists can do with the general public, because if they raise more awareness of what pharmacists are capable of, then patients would come to the pharmacy and ask people for more advice. I mean, I went into a pharmacy many times living there, and just felt like I would just buy products, including things that were prescription only. You'd still be able to purchase them behind the counter, which was really a new experience for me, and I didn't expect that. Things like insulin were being, patients were buying this over the counter, and when I worked in emergency services, there were so many times where our ambulances would go to somebody's house because they've got hypoglycemia. They've utilized insulin when they're not actually diagnosed as a diabetic patient. They've used it incorrectly and used it too much. And obviously, their sugar levels drop significantly, and then they require an ambulance for support. And that happened multiple times when I was working in emergency services. And I think there's so much more that pharmacists can offer the community in the UAE, but I think we probably need to start helping the general public believe in what the pharmacy profession has to offer in a community pharmacy.
I completely agree on that. And actually, I feel like we're already starting to do that. For instance, when I was doing my undergrad, a lot of our projects or research projects just involved research, or like that involved what is it called? The thing where you make people choose questions and
Oh, like surveys?
Yes. Oh my God, I forgot the word. But
That's
yeah,
okay.
a lot of research involved like surveys to see the perception of people here in the UAE about what a pharmacist can offer, what type of help they can receive if they go to a pharmacy or if they go talk to their local pharmacist. So I've seen a lot of students do that actually. And the research would involve like around 500 to 600 participants. So I feel like if we work on it, we're getting there. Yeah.
Absolutely. That's super cool. I'd love to see that feedback. I might Google it. Um, cool. So your internship at least had a lot of variety, gave you some exposure to different areas of pharmacy. And now you're in the process of applying for your exam to qualify as a pharmacist. What has your experience been in terms of the licensing procedure and what's available to you online from the health authorities? Because as a pharmacist in the UAE, because there are multiple different emirates, and for people who are listening who don't know much about pharmacy, depending on where you live, you may have to apply as a pharmacist independently. So Dubai, for example, has its own health authority where you would apply for a pharmacist, but that doesn't then allow you to go and work in Sharjah, Ajman, or Abu Dhabi. When I worked there, I was mainly in Abu Dhabi, so I was licensed as a pharmacist with HAD, which is the health authority of Abu Dhabi, which I believe might have changed in terms of the name now. But you definitely have to kind of look these things up. How have you found finding that information on the internet?
So this is actually something that we were told about when we were doing our undergrads. So we were told that if you want to practice at the Northern Emirates, you have to sit for the MOH exam. If you want to practice for Dubai, you'll have to do the DHA exam. And as you said, if you're practicing or willing to practice in Abu Dhabi, you do the HAD exam, which is now the DOH, the Department of Health in Abu Dhabi. But the good thing is that if you obtain a licensing in under one of these authorities, you can convert it to another authority after some time or after like a couple months of experiences. So yeah, it can be done. And in terms of the material to study for the exams, if you were asking about that, it's actually what we share with each other as students or as fresh graduates, or even what our seniors share with us. There are a lot of WhatsApp groups or like even Facebook groups that upload a lot of materials, and even those who sit for the exam, they would share the type of questions they received and how they prepared for that exam. So yeah, that's basically how all of us are doing it.
In terms of getting licensed as a pharmacist, when I moved to the UAE, I obviously qualified with an MPharm degree, but there are some pharmacists that will qualify with a BPharm. And obviously in the US, it's very common to have a PharmD. And depending on your qualification as a pharmacist, you potentially got different licenses. And those licenses then allowed you to apply for different jobs, but also have different roles within the pharmacy setting. And that could be a difference between community and hospital, or even in hospital, outpatient versus inpatient. And as a pharmacist coming from the UK, I completed 4 years of my degree, which is an MPharm, and then I did a 3-year clinical diploma in pharmacy. And I was expecting that I would definitely be able to get a clinical pharmacist license. But once I applied with the Health Authority of Abu Dhabi, I realized that that extra diploma wasn't accepted to allow me to work as a clinical pharmacist. And I've said this to you before, that I feel like every pharmacist is a clinical pharmacist, and I wish we could remove this whole terminology from licensing procedures and the way people perceive pharmacists in reality, because we all work clinically. We're all trying to clinically screen prescriptions, from evidence-based medicine to ensuring safety for our patients and ensuring that our patients get the most and the best use of that medication. So we definitely are all very clinical. But when I moved there, that culture difference and that licensing difference really shocked me, because it's not what I'm used to. And from our previous conversation when we were just chatting, and obviously you've been in your intern roles, you will have seen what different pharmacists are allowed to do with their licensing. And how has that impacted how you feel about becoming a pharmacist and your thought processes on your next steps now that you're about to qualify?
Yeah. So, first, I think the reason we have a differentiation in titles, let's say, which is not something that should be there, but it is there and there is nothing we can do about it. So, yeah, the reason I believe there is this differentiation is because there is a huge focus on retail practice here. There aren't many institutions implementing the clinical practice that would allow a pharmacist to practice freely and to practice things that he should be practicing and things we were trained for during our undergrad or during our master's or postgrad. So that's one thing. And also, it's actually defined by the ministry, whether that of Ministry of Health for Northern Emirates or for the Dubai Health Authority or the Abu Dhabi Department of Health. So there is actually a document called PQR, if I'm not mistaken. It's a document where you can see what your qualifications or what your degrees allow you, or in which area you're allowed to practice as a pharmacist. So, for instance, if you have a 4 years degree, an undergrad bachelor's in pharmacy, you're only allowed to practice as a retail or a community pharmacist or a pharmacist one, for instance, in OPD or inpatient pharmacies or outpatient pharmacies. Whereas if you want to be qualified as a clinical pharmacist, you need to have your bachelor's plus a master of 2 years. It has to be 2 years, or a postgraduate PharmD that can also be 2 years or 4 years, depending on the institution you're attending. Add to that, you need to have a residency in clinical pharmacy or a PGY1 residency. Um, there might be exceptions if you have 2 years experience in a hospital setting. You might be able to qualify as a clinical pharmacist once you pass the exam, because the qualifying exam for retail pharmacy is different than that for clinical pharmacy. So if you plan to become a clinical pharmacist, you kind of have to sit for 2 qualifying exams. And for a pharmacy technician, I think it's only a 2 years degree and then a qualifying exam, and that's it. So it's actually already predefined by the ministries, and there is a document called PQR if the listeners want to go and check it. So yeah, they can find details on that.
And things change all the time in the UAE, don't they? That's another thing. You have to keep up with all the changes depending on where, especially which emirate that you plan on living in. So keeping up to date with all the changes from the variety of sort of health authorities is really important. What are your next steps, and why are you making those decisions?
Speaking of changing rules, I thought that it would be best if I could get a PharmD degree or a master's degree now, especially that I'm young, I'm not committed, or I'm not committed in a relationship, I'm not married, I don't have kids, and thankfully I have my parents supporting me financially. And yeah, I thought it would be great if I could get my PharmD degree now, and yeah, to be able to practice as a clinical pharmacist later on. But if I'm being honest with you, Anisha, I'm not really keen on having a certain title or having a certain job position. I would honestly just love to have a career that would align with my values, whatever that is. I don't know what's the future holding for us. So I just would love to have a career where I feel fulfilled for sure. And I would love to have a career where I can receive back as much as I give. Not, yeah, uh, I don't want to feel like I'm just given without return. I want to feel appreciated, valued, and yeah, valued for the thing I do, for the things that I do. And I also would like to have a a work life balance, because I'm someone that values family a lot and values the sense of home a lot, especially that I have lacked that for the past like 5 years now, being an international student. And with COVID, I wasn't able to travel back home. So I really would love to have that sense of home, sense of family later on during my life. And I don't want my job to hold me back from that. If anything, I would love it to have to for them to be supporting, completing each other in a way. Yeah, if that makes sense. But yeah.
It makes absolute sense. And, that's a really mature decision-making kind of experience that you've gone through. You've seen what's happening in reality as an intern and going on placements. And you've probably had conversations with a lot of pharmacists who are much more experienced and who've been through the hardships of not really being able to gain promotions or change roles within their hospital settings, as an example, because the qualification itself is holding them back from being able to have any other opportunities. And unless they get those additional qualifications, which by this point, they are so far into the career, they have, a wife or a husband, multiple children at home, it's very difficult to then step into full-time education, as an example, or even part-time education whilst working. Normal working hours in the UAE are around 48 hours a week, so it's a 6-day work week technically. And work-life balance to those people is really valuable. So they are unfortunately in the position where they definitely would love career development, but at the same time, they're in a position where family life becomes so much more important to them on their values list that they prioritize that element and they utilize the job to generate income to support that home life, which I feel is a shame to some extent. I hope that things kind of change for those people, because it would be nice, especially with all the experience that they have, to be able to experience other opportunities that pharmacy has to offer. But I think what you're doing is a very sensible, logical, and courageous way of working. You understand what the environment is like where you're living. You definitely want to be a successful pharmacist. You definitely want to be fulfilled in your role. So you're going about it in a very mature way. And I love that professional attitude from you. I think that doing the PharmD will be an amazing opportunity for you to develop your skills and develop your knowledge and put yourself in the best position to get the job of your dreams once you qualify. And also, if you decide to go home or go to another country, that qualification will definitely put you in the right position to get great jobs in other places. So I think you're going about it in the right way. And you're right. When you're not married and you don't have children or anyone else to kind of worry about in your life at this point, it's easy to continue that education journey. And it's great that your parents are supporting you, as a student, but also financially, because that's really valuable in terms of just being able to focus on the education side. I've loved having this conversation with you, and I've loved that we have found each other through LinkedIn and we've made this connection and this relationship, which I hope will continue long term. I've really enjoyed our conversations so far, even off the podcast. And, I'm wishing you all the best for the future.
Thank you, Anisha. I had such a lovely time being here. Thank you so much for inviting me. And as you said, I hope this relationship goes on for so long. Thank you so much.
No worries.